Hello everyone, I'm Dr. Salada Veronica Imkun. I'm making this video for pregnant women and awaiting mothers. It's about antenatal care. Antenatal care is a specialized form of care that is given to pregnant women in order to enable them attain and maintain good health throughout pregnancy, and also to increase their chances of having a safe delivery. So antenatal care is very important, especially because it will also help you to avoid complications that are associated with pregnancy. The aim of antenatal care is to screen the high-risk patients. We want to screen for those who have high risk and low risk. We want to also prevent or detect and treat at earliest any complication. We want to ensure continued risk assessment and to provide ongoing primary preventive health care. So our aim is to help you attain and maintain good health, and to educate you on the physiology of pregnancy and labor by demonstration, by using charts and diagrams, so that fear is removed and psychology is improved. During antenatal period, you are first of all expected to book, and during that booking period you will register by, they will give you card, you pay, they will give you card, and then you open folder. Then your weight, your height will be taken. This is so important, so that we can continue to monitor the progress of your growth and health during that pregnancy. Then you'll be expected to do some investigations by PCV, which is to check for the level of your blood. Your blood group and genotype will be done. The blood group is done so that we know whether you are the kind of blood group you have, and your rhesus factor, whether you are rhesus factor negative or positive. This will help us to further manage you well. We also screen you for hepatitis B and C and HIV. They are very important because if you have any of these diseases or sicknesses, it will help us to help you, counsel you on how to prevent you from transferring this to your child, and also how to manage you well, so that you will not come down with any sickness or illness during the pregnancy and even after the pregnancy, if you keep to our instructions and to the medications that you will be given. Urinalysis is also something that you need to do, as I've said earlier, where we check for your sugar level, the sugar in your urine and the protein in your urine. If there is protein, we will now further investigate you to know and test you and examine you to know whether you have a condition we call preeclampsia or other conditions, which will also help us to manage the progress of your pregnancy. That is why it is good for you to come and book in the clinic. Obstetric scan is also very important. With scan, we will not just confirm your pregnancy, but we know the number of babies in your womb. We also know whether the baby is alive, the placenta location. If there is any problem with scan, we'll be able to detect it. So it is important for you to do scan. Other things that can also be done and is done in some places is venereal disease research laboratory test, which is tests for syphilis. Even some do tests for toxoplasmosis and others. So doctor will take history from you, including your past pregnancies, your present pregnancy, and then if you have taken any medication or you are on any medication. Even your family want to know, is there any drug you are reacting to? Are you drinking? Do you take alcohol? Do you smoke? We want to know everything because it will help us monitor your well-being. They will now examine you, as doctors will examine you, or any doctor you meet during the antenatal period will examine you properly. If there is anything detected, you will also be carried along. It will tell you everything. All these things is just to see if you are in good state and that the baby is in good state. It's also important to note that there are drugs that are used in pregnancy. It's not every drug that is used in pregnancy, but we usually give some drugs. These are called routine drugs. They are iron, folic acid, vitamin C, multivit, and anti-malaria. And it's not all anti-malaria that you are expected to take in pregnancy, and that's why you need to come to the clinic. You don't need to do these things yourself. I know there are so many information that are available online, but drugs that are safe in pregnancy and there are drugs that are not safe. So you need to be careful when taking drugs. And if you have been on medication in the past, you have been taking medication before you conceive, there is need for you to visit the clinic or a hospital so that you. It's also important for you to know that you are not supposed to wear tight clothes. Try and wear something that is free on your body, because you have to be psychologically prepared that you know you are expected to buy clothes as the pregnancy advances, or to use the ones you have before. Then avoid wearing high heel shoes, because that can make, when you fall, it can lead to trauma and even early delivery of that baby that is not yet well formed, or the lungs are not yet mature to survive life outside the womb. You also need to know that there is need for you to avoid traveling long distance, because the roads are not, some of the roads are not good, and if you enter into gallops, that can trigger labor before the time, and it can also even cause the placenta to detach from where it is normally located, and that can lead to bleeding and lead to even the death of the baby or even early delivery, and which will cost you so much in the hospital because admission and everything. So prevention, they say, is better than cure. Avoid traveling long distances. Avoid sitting there in a place for long because of deep vein thrombosis. Even traveling long distance on flights in the air, and even by road. By the time you sit down for long in a place, it can cause deep vein thrombosis. And it's also very important for you to know when there are complications, because they will call them danger signs. Try to present to the hospital. What are these complications? The complications we're talking about: bleeding, when you see yourself bleeding, whether mild or severe, having serious abdominal pain, stomach pain, in a layman's language, when you see the water, the lipo water has drained before it is 9 months, fever, you are running temperature, because if you run temperature, it can cause the baby to die. It can even cause the baby to come out before time. It can cause abortion. So when you notice this danger sign, even apart from that one, you notice that you're having urinary tract infection or you're having discharge, you need to come to the hospital, because those things can cause you to have abortion, spontaneous miscarriage, or it can cause the baby to come out before 9 months, which is not good, because the lungs of the baby is not yet mature. So when you see this danger sign, try and come. It's also important for you to know that exercises are very important, and it is not all exercises that you involve in, but there are certain exercises that is ideal for pregnant women. When you do exercise, it helps you to attain good health and maintain that health throughout pregnancy. Even after pregnancy, it will also help you. You need to also know that immunization, there are certain immunization you need to take. That's tetanus toxoid. It's given 5 times and then you take booster after every 13 years. So when you are it depends on when you present in pregnancy. If you present early, you may be giving up to 3 of them, because the first one give as a presentation, the second one 4 weeks, this one 6 months, the next one will be given 1 year. So it's not, you can't take the life in one pregnancy, but the subsequent pregnancy you take the remaining, and this will be gotten from you from the history you give us during the time of booking. Now, having said this, it's good for you to prepare yourself psychologically, financially, and otherwise for delivery, because it's not every delivery that will happen by vagina. Some of these delivery will be by cesarean section, and it will involve so much money. Even the one that you are going to deliver on your own, it is still going to involve money. So you need to prepare yourself financially. You need to also prepare yourself psychologically for the safe delivery of this baby. And I also want you to know that you have cesarean section does not mean you have abnormal birth, or it's a taboo. It's not a bad thing. To save you and to save the life of the. What are the symptoms of pregnancy? Just before I end this video, I would like you to know some of the things, the symptoms that will tell you that you are pregnant. And that is mixed period. You didn't see your period again. You experience breast fullness or pain in the breast. Slight bleeding, maybe just few weeks after your last menstrual period or after your ovulation. That is what we call decidual bleeding. Then you see your nausea, you feel like vomit. Your legs may swell up. It's not in every pregnancy. You see yourself having excessive craving for things unusual, maybe like chalk. Some also they don't have appetite. Some you see yourself eating even more than you've been doing before. Then urinating frequently. Changes in your skin color, that is dark. So like the linea nigra is in the abdomen. That's a darkening from the lower part of the umbilicus downwards. All these things are response to hormones which are present during pregnancy. When you begin to see all these things, you just calm down, do your pregnancy test, and then present to the hospital. Quickly, I will talk about the postnatal care. It is important to put this baby to breast within 30 to 1 hour after delivery, and exclusive breastfeeding is encouraged in breastfeeding option. And what do we mean? You have to breastfeed this baby only on breast milk for 6 good months before you initiate other feeds, and you still continue to breastfeed this baby for up to 2 years if you can meet up to that standard. And there are other conditions whereby for an HIV patient, we encourage in our setting, if you want to breastfeed exclusively, you breastfeed for 1 year, maximum of 1 year. That's when you breastfeed. There are other things, caveat to that, other things you need to know. So that's why it's good for you to come to antenatal clinic. Also important to tell you about immunization schedule, that you need to take your baby for immunization. It's to prevent infections. There are common infections because the baby's immunity is not yet good enough to fight infections. So with this immunization, it will help stimulate the production of antibodies that can protect the baby from infection. So you need to go for the immunization, carry your baby there so that they will immunize the baby. And if there is any problem or any issue, you let the healthcare workers know. They will definitely attend to your baby. Another thing is, if the baby has or develop any condition, clinical condition that you are not comfortable with, don't stay at home trying to treat the patient. Try and bring the baby to the hospital. And then you need to know how to take care of the umbilical cord by using methylated spirit to clean the umbilical cord in order to prevent infection like tetanus, so that the baby will not have infection. You keep cleaning on daily basis until the umbilical cord falls off. In conclusion, you need to be psychologically, mentally, emotionally, financially prepared for pregnancy so that you can attain and maintain good health throughout pregnancy and delivery period. God bless you.